Good morning. Thanks for being here with us. On KWCH, I am joined by Dr. Scott Moser, and he is here to talk about JayDoc Clinic, and he is with the KU School of Medicine. Good to have you here this morning.
Thank you, Karen.
Okay, so we are talking about the JayDoc Community Clinic. It's a special kind of clinic that's opened when a lot of others are not.
Yes. We're open on Saturday mornings from 9 in the morning until 1 in the afternoon. We designed that because you need to understand JayDoc Community Clinic is a student-run clinic. So all of the patients are actually seen by a local physician who has a license to practice medicine, but most of the administration of it is actually run by medical students. And it started as an effort to meet the needs of our community, especially on Saturdays when low-income people who can't afford to leave work during the weekday can come for medical care then.
And that's an important point to point out too, is that this is for people as well who may not have insurance, who may not have the financial resources to go to a doctor, and it can cost hundreds if not thousands of dollars depending on your condition sometimes.
That's correct.
Okay, and so what are the different treatments that you provide at this clinic?
We provide quite a variety of outpatient services, and if patients, if when people come to our clinic for care, if they do need to be transferred to a hospital for inpatient care, we can do that. But most of what we do is standard ambulatory care for adult patients. So that involves both care of acute conditions as well as some chronic disease management, things like diabetes care, hypertension care, some of those chronic sorts of problems that people have.
Okay, and you are one of the faculty advisors.
Correct.
So to speak.
I'm the faculty advisor, and then I spend some of my time also volunteering on Saturdays as the supervising physician for the students that are involved at the clinic.
And that's where I was going to ask you next. A lot of times you hear students and you think, well, is the quality of care going to be the same? But these students have been in medical school for, what year are they in?
Well, the ones that are primarily seeing patients are upper-level medical students who've had some clinical experience. But we also involve preclinical students as part of learning intakes. So they're learning how to just take patients to the rooms and watch what goes on and help us collect vital signs on patients. We also have pre-medical students involved from our local universities who want to find out more about what medical care is like, and so they're also observing and participating in things, but they're not the ones primarily seeing patients.
And obviously you're already seeing people, so what does it take if someone wants to become a new patient of yours?
Okay. The JayDoc Community Clinic is run as a joint venture between the University of Kansas School of Medicine-Wichita and the Guadalupe Clinic. And so we run in the same offices that are occupied by Guadalupe through the week, and as far as making appointments, people would call the Guadalupe Clinic to do that.
Okay, Dr. Scott Moser, thanks so much for coming and talking to us about the JayDoc Community Clinic. So now you know, open on Saturdays from 9 to 1. Thank you very much. Have a great day.
Thank you, Karen.